Dr. Tyler Williams with Pinecrest Dental. Thanks for joining us on this video, and you're here because you have some questions about bad breath, or you're not happy with your smile, or damaged, missing, broken teeth, and that's probably hurting your confidence, but you're probably also noticing that you may have some bad breath or bad taste in your mouth, and that can really hurt our confidence, whether it's dating, getting a job, being promoted, looking for a new career, new social circles, and, not having confidence or having the worry about bad breath can really detract from helping us feel great. So I'm going to provide you with some tips and some things you can do for bad breath. And of course, if you have any questions or want some more information, you can call our office. We do have some additional material on this topic that you can request, and we can either email that to you, or you can swing by and grab a hard copy of one of our books or handouts on this. But to kind of get into the cause or the reason you may have bad breath, there's usually three main causes. And the first one we usually find is there are holes in your teeth or you have broken teeth. So cavities really means a cave or a dip or a bump or a hole in your tooth. And that's where bacteria can hide, and it's very difficult to brush that out, if not impossible. And so if you have a cavity that's hidden, or maybe a tooth that broke off that's very obvious, bacteria is going to hang out there, and even though you may brush it, you can't get all of it out, and that causes bad odors, right? The second one is gum disease, gingivitis, periodontal disease, gum disease. There are differing levels of this. But when your gums are sick or unhealthy, there's millions and millions and even billions of bad bacteria that are on the roots of your teeth underneath your gums, and they do not brush off on their own, unfortunately. Once you have that removed professionally, then your brushing and flossing prevents it from coming back. But once it's there and it's camping out and it's growing and it's established a place where it's comfortable, it will not leave on its own. Unfortunately, it's kind of like squatters or maybe family members that you don't want to stay. They just want to hang around and not leave. And so there are, those are the two of the most common causes. The third one is dry mouth or snoring or sleep apnea, because that can cause your tongue and your mouth to have less saliva. Saliva cleans our mouth. It washes away bacteria and food and odors. With a drier mouth, you're going to notice that bacteria that might be normal becomes too strong, or bacteria that's bad can overgrow and can cause you to get irritation in your tonsils, tongue, back of your throat, taste buds, causing bad breath. So those are the most three common causes that we see. There are some things you can do today that will help with that, and I'll go through those here. The first one is drinking more water. Even if you don't like water, or you don't like the taste of it, or you find it boring, if you just swish your mouth out with water between meals and after you eat, or when you have that bad taste or your mouth feels dry, that water will help neutralize the acids that cause the bad breath. Okay, the second one is, if you're not already brushing, then do that, of course, but flossing or using a water pick once a day. When you brush it only cleans about 2/3 of your tooth. 1/3 does not get touched by your toothbrush, and so you need something to be able to get between your teeth better. String floss is great. Floss picks are great. A water pick or an air flosser are great as well. That'll keep that bacteria from invading your gums. Again, if it's already there, it needs to be removed professionally, but that will help keep it from coming back. Third one is using a tongue scraper. And a tongue scraper, they can be purchased at the pharmacy or online. If you use them in the morning, they're great. You can see lots of bacteria coming off those. And they found that actually in hospitals, patients who had been admitted to the hospital had about 1/3 less problems with cold, flu, and sickness when they had a tongue scraper, because our tongues can absorb so much bad bacteria. Especially if you're a mouth breather or a snorer, you're more likely to get colds and flu because of what can be hiding on your tongue or in the air. So you may want to get some help with your snoring or your sleep issues as well, and that's something that we can provide some resources for you as well, if that's something you need help with. Now, I'll give you a fourth one, which is a bonus, and this is called a saliva test, all right? And It's painless. It'll be the easiest test you've ever taken. If you can spit in a cup, you can take this test, right? So you think about when you go see a physician, or you go to the emergency room, or you're having a medical issue, you can have some tests done. These might include, x-rays, CAT scans, blood work, blood draws, different examinations, some normal and routine, some can be very uncomfortable. And typically, the earlier you act, the more comfortable it can be. Well, a saliva test is a new way that we can test the atmosphere, so to speak, the biology, the layout, the real estate in your mouth without any pain. So you spit in a cup and we put it in a special testing kit on a strip and we run it through a really cool machine and it will give a printout that groups together what things you may be susceptible for, levels of acid, levels of ammonia, levels of bad bacteria, levels of good bacteria, your risk for cavities, your risk for gum disease. And it's really cool because once a year you can have that tested, and even more often if you need to. But it's relatively inexpensive. The results are fast, painless, and it can really help you map out the future of your mouth and your health so you can get through problems, which a lot of people have, like, hey, I'm brushing my teeth, I'm still getting cavities, or my teeth are broken, I think they're too far gone, I just need to have them all taken out and get implants. And most people who come see us actually aren't candidates for full mouth implants, at least not as their number one option. There are some in-between options that are much better, much more comfortable. You still get the look of implants without having to lose all of your teeth. So if you have questions on this topic or any others, please reach out to us. Don't hesitate. Our phone number is below. You can call us or you can go to our website and you can contact us there by email and we'd be happy to provide some more information. So thanks for watching this video and we will see you on the next one. Have a wonderful day.